It allows us to look at the evidence and look at gaps in our service and take an assessment, but also understand the barriers that these moms face and accessing those resources, those benefits, those treatments, and those supports so that we can ensure that we're filling those gaps and fulfilling those needs. Because ultimately, if we can do more on the prevention side and do more to understand what's driving some of these issues, then we can help prevent them on the front end.
I think you answered the second part of that question also, and that is, where does this fill in the gaps? But it is very broad and far-reaching, isn't it? It's pretty exciting.
It is. It's a comprehensive program, and again, it looks at tried and true methods, things that have been proven to be research and clinically sound, and it allows us to take those methods that have been used elsewhere around the country and employ them on a massive scale and really look at them in a different population, one that's never been really studied to this significant effect, and that's the justice-involved population. Those who are struggling with substance abuse, oftentimes who are going into a justice-involved situation, and then the impact that has downstream on things like our child welfare system, for example. That's something that, as we see more and more kids who have went into out-of-home care, we're noticing a trend that it's correlated to the increase in substance abuse and that drives neglect. And so being able to provide supports and get in on the front end of that to avoid these situations, it's perfectly aligned with some of the other transformational efforts that we have in the cabinet.
In Kentucky, we have high rates of incarceration for women in a country which leads the world in incarceration. For 1 out of every 3 women incarcerated somewhere in the world, one of those women is in this country, 1 out of every 3. And those rates are too high. In Kentucky, we have too many children impacted by incarceration. And mental health leads the way in factors which really cause that incarceration, regretfully. And so to partner with Yale in an effort like this would be a game changer for us to try to turn those numbers back and get more women back into communities with wraparound care. And we partner in very innovative ways now with our Cabinet for Health and Family Services. We've begun a dialogue in this administration that has been, hasn't been seen before. And it has yielded some tremendous results for us and tremendous wins for both policy and for the women we serve and the children we serve. But at the same time, just to reach out beyond our own discussions to partner with a successful program like this one would also be a game changer. Whether it's a substance use disorder or a mental illness or both and a co-occurring disorder, we know that far too many of our women in prison and jail are suffering in those ways. And so, again, a program like this one from Yale will help us add to our already, I think, impressive list of interventions. But this is, again, I think, tried, true, and tested, and it will yield great benefits for us. Using strategic intervention to make certain that children have access to proper nutrition, proper health care, proper mental health care, and that the women, moms, have proper access to the very same things at trying to raise these children, I think is critical at keeping them out of the criminal justice system, where oftentimes that just becomes criminogenic. It just makes things worse for these women and their families.
The governor has been very interested in mental health issues, recognizing that severe mental illness and other mental health issues can lead to substance use disorder and other disruptive and destructive behaviors. And so this opportunity to partner with Yale to conduct the research, to collect the data, to analyze the data, and to formulate really good policy initiatives to help address mental health issues that lead to these destructive behaviors that result in incarceration, other disruption to not only the moms, but the entire family unit, including the children. This is a very exciting opportunity. This is a data-driven administration, and this administration welcomes data, utilizes data to help really drive good, solid policy decisions. It's critical that we use the empirical evidence that exists to really formulate those strategies to address some of these really, really difficult issues that are have such a profound impact on families across the Commonwealth. For the Cabinet for Health and Family Services, led by Secretary Meyer, and our Justice and Public Safety Cabinet, led by Secretary Tilley, to have the opportunity once again to collaborate on such an important program, working with Yale University, really developing good, solid policy initiatives to help our moms and our families across the Commonwealth is once again just something that the governor embraces and really is a hallmark of this administration.